The ACA was never affordable or care. It was a white-collar heist in plain sight. By Phillip C. Parrish. Republican candidate for governor of Minnesota 2026. Navy veteran, farmer, fraud investigator, whistleblower. Fellow Minnesotans, I've spent decades exposing fraud, from Navy intelligence to Minnesota's feeding our future scandal, and I've seen the playbook before, but nothing prepared me for the scale of the Affordable Care Act, ACA, a premeditated white-collar criminal scheme disguised as compassion. It wasn't just bad policy. It was engineered to devastate families, enrich corporate elites, and silence dissent, all while keeping compliant politicians in power. Let's cut through the spin. 1. Affordable? Tell that to the 300,000-plus Minnesotans who lost their plans. Remember Obama's promise, if you like your doctor, you can keep your doctor. If you like your plan, you can keep your plan. That was lie first. In Minnesota alone, over 300,000 residents were forced off their existing plans in 2013 to 2014. Families who had stable, affordable coverage suddenly faced premiums that doubled or tripled. The Star Tribune reported one St. Cloud family's premium jumping from $400 to $1,200 a month for worse coverage. Nationwide, 6.2 million Americans lost their plans despite the president's guarantee. The White House knew. Internal memos later exposed showed they expected cancellations. They lied anyway. 2. Care? It was a corporate cash grab. Who really won under the ACA? United Health Group, headquartered in Minnetonka. Stock price plus 1,100% since 2010. CEO compensation, $100 million plus in some years. Blue Cross Blue Shield of Minnesota paid executives $17 million in 2022 alone. In hospital systems, charged 300 to 500% markups on procedures, knowing insurers had to pay under ACA mandates. Meanwhile, deductibles skyrocketed. The average Minnesota family now faces a $5,000 plus deductible before insurance pays a dime. That's not care, it's a tax on the sick. And let's not forget the Navigator grants, hundreds of millions funneled to politically connected nonprofits, many tied to DFL insiders to help people enroll. In reality, kickbacks, ghost employees, and padded contracts, the same fraud I exposed in state programs. 3. The political protection racket. The ACA wasn't just about health care. It was a political weapon. Challenge it, you're gone. Ask former Rep. Rick Nolan, DFL MN8, who dared criticize ACA implementation in 2013. He faced primary threats and retired under pressure. Pressure. Pun defend it? You're funded. DFL legislators who towed the line got millions in campaign cash from healthcare PACs. Follow the money on open-secrets.org. The 2025 shutdown? Same playbook. Democrats manufactured a 40-day crisis, starving federal workers and delaying SNAP, just to protect expiring ACA subsidies. Why? Because without the fear, the scam collapses. As I said on Phillip C. Parrish, they held America hostage for 40 days, not to help families, but to prop up a failing system that enriches insiders. Then they cry, "We were winning." No, you were weaponizing pain. 4. The tacit harm was the plan all along. This wasn't incompetence. It was design. Unforced dependency, make insurance unaffordable without subsidies, trap people in government programs, punish the middle class. High premiums plus high deductibles equal to medical bankruptcy, still the first cause in America. Silence whistleblowers, I've seen it. Agencies retaliate against anyone exposing waste. The ACA baked in gag orders for providers who spoke out. The endgame? A single-payer pipeline, where the government controls your health care, and dissent is disinformation. Minnesota deserves better, and will deliver it. As your governor, I will. 1. Launch an independent audit of every ACA dollar spent in Minnesota, recovering fraud like I did in state programs. 2. Repeal Mensure and replace it with transparent, competitive markets. No more insider deals. 3. Cap hospital overcharges and ban gag clauses on doctors. 4. Empower patients with tax-free health savings accounts and cross-state insurance purchasing. No more lies, no more games, just real care, real affordability, real accountability. Rise, Minnesota. Rise again. This isn't left versus right. It's right versus wrong. The ACA was never about helping you. It was about controlling you. I'm Phillip C. Parrish, Navy veteran, farmer, fraud fighter, and I'm running for governor to expose the grift, protect your family, and restore prosperity. Join me, donate, volunteer, spread the truth. Because Minnesota families deserve leaders who serve, not a system that exploits. ACA was a scam, or Parrish 4MN, or Parrish4MN.com news. Phillip C. Parrish, candidate for governor of Minnesota 2026. Phillip C. Parrish or Parrish4MN.com. Search